Okay, once again, my name is Ho. Just want to share what acupuncture does for well-being. Just at the bottom, it says there's sufficient evidence of acupuncture's value to expand its use into conventional medicine. This was back in 1997, so much has been done since then, and there's a lot of things going on with acupuncture. More smart people are out there; they're doing more research, and they're helping people all over the world. Okay, so just briefly, a little bit more about me. I'm a retired U.S. Army major. I did intelligence work for the Army. Once I retired from the Army, I went back to school. I went to Bastyr University to study acupuncture and Oriental medicine. Um, Prior to that, I also went to medical school briefly to make sure that I have an understanding of Western and Eastern medicine. So after graduating from Bastyr, I have a license with the state of Washington, and also our national board, our commission, it's NCCAOM. I'm a diplomat of that. And ever since then, I've been working out of St. Francis and St. Anthony, helping both cancer patients and um, people of all walks of life. Okay, so this is what I'm going to talk about today. That's the agenda. A little bit of history, types of acupuncture, little effects, the benefits, some conclusion. I'll give some references afterwards. But bottom line up front, acupuncture improves quality of life. And they've also discovered that it lowers healthcare costs. Okay, so acupuncture has been around for thousands of years. And basically it's on the theory flow of energy called qi. Qi is a life force. It's an energy flow that runs throughout our body, and it flows through and around the body along pathways called meridians. And it's certain pathways that we have on our bodies. I'm going to show you a slide. You might have seen it, some of the pathways that we have, okay? So basically the qi, the energy, has to flow freely throughout the body in order for someone to have a good health. Certain points along the body may indicate different types of illnesses, and those are things that the acupuncture practitioners will check when you're there. So again, illnesses occur when the energy is blocked, and acupuncture is basically used to unblock that energy. So like I said, this is the channels or the meridians that we call it. There are three on the inside of the body or inside part of the arm. Outside of the part of the arm has three on the inside of the leg and three on the outside. And there are one directly running down the middle of the body and one down the back. So there are a total of 14 channels. There are some additional channels that basically connect other parts of the body, but we basically go with 14 channels. And these channels or meridians are connected to the organs that we know, and therefore they are named. You can see on the slides to the left, all the major organs that we have in our body and how they're connected. I like this slide because it kind of gives you what the organ is and where the channels kind of run. It's just giving you a brief idea of what the channels that we're looking at. I can't teach you acupuncture in just 30 minutes, but I'm just giving you an overview of what acupuncture is all about and what organs or what channels that we target. So these meridians and these organs are also associated with clock. We call it, it's a clock association. So you can kind of look at what times that they are. And just a quick example is a large intestine is between 5 and 7 a.m. So it's basically tells you that going to the bathroom to do number 2 at those times is opportune and it's best for the body, and it also indicates that the person is healthy. That's when it happens. Another example that I could give you is liver. If you tend to wake up between 1 to 3 a.m., every night. Basically, maybe you're irritable, you have some stress that you're dealing with. So some of these things that practitioners would utilize to tell you what's happening in your body, what you're going through. Okay. Next one is basically another association. We call it 5-element association. Top is wood. To the right, you go down, it's fire, earth, metal, and water. And these are also associated with the organs that I talked to you about earlier. So again, wood is liver and gallbladder, fire, heart, small intestine. And these are things that the practitioners or acupuncturists would utilize once again to see what areas need to be worked on. Okay. So once again, acupuncture is basically inserting needles at specific points along the channel, along the body, where the energy is blocked. And it's stimulated to those locations so that the blocked energy is open, so that the energy force of the body would run freely to basically regain health. And furthermore, it basically to redirect and normalize the flow of energy and bring patient back to health. And that's what we focus on, okay? So well, like I said again, we're focusing on unblocking stuck energy, again, to move energy using acupuncture points, and then it's to balance the organs, the meridians that I showed you earlier, and ultimately to bring homeostasis. So this is some of the things that we use as acupuncture and oriental medicine practitioners. Excuse me, sorry. So the first thing, the diagnosis that we utilize, okay, are pulse, tongue, face, and whole body. And these are things that we look at from the beginning. So if you look at the top right, basically there are 3 positions on the wrist that we look at, right and left. And these points are also associated with the organs, meridians that I talked about earlier. So a practitioner will basically check the pulse and checking for characteristics of these locations. We're also checking whether it is on the surface or deep. It is, the pulse is crawling or taut. It's a lot of different things. And we basically have an understanding or idea of what's happening in the person's body. Okay. Next thing is tongue. And tongue also shows different organs that we're looking at. If you look at the tip is the heart, and then lungs, stomach, and spleen. These are areas that we would look at. We're looking at the color of the tongue, also the coating of the tongue. Okay. So color, we need to have a pinkish color, which means that the blood is flowing freely. And that thin white coat indicates that good digestion of the individual. Okay. We also look at the face, and face also shows different types of organ. And so these are also another way for a practitioner to get an understanding of what the person is going through. So based on looking at all these things and also a story from each patient, we get a pretty good understanding of what's happening to that person's body. Yes. So, and like I said, if you have questions along the way, you could just jump in, unmute, and you could ask questions, and then we could talk about it. This is first time doing it live. I've always been at SPU talking to people about these things. This is so very different. Okay. As we treat patients, there are 3 phases that we're looking at. Initially, a person comes with pain, we'll work on the relief phase. Okay, so we can see that we're looking at providing immediate relief of the pain. Okay, because we see the symptoms and signs right away. So that for the relief phase, we have more visits, more frequent visits to take care of that issue. So it would normally be about 2 visits a week. And then as things get better, we move into a corrective phase. As symptoms and signs start to disappear, there will be less frequent visits, maybe once a week, and then it'll later become once every other week. And then finally, we move into maintenance and wellness. So it may be once a month or once every other month to kind of get a tune-up of what's going on with your body, okay? So here, I just want to give you an idea of some of the acupuncture that we use. There are different types of acupuncture. Basically, the conventional acupuncture, which is placing needles along the acupuncture points along the body. Like I said, it is to unblock stuck energy and to affect particular parts of the body to help with their symptoms, okay? Some people also use scalp for acupuncture. I may do that at times. It is placing needles on top of the head according to a map of the brain functions. So there are different, if you could see on the slide, there's like the motor areas, speech areas, sensories, and these are areas that we would target to help with basically altering blood and hormone levels of the brain and throughout the body. So this is one type of acupuncture. There's also electroacupuncture, where we would use this to help with chronic symptoms and basically to prevent any kind of accommodations for long periods of time. Okay, so there are also other types of acupuncture that I didn't put on. Some practitioners may solely use ear for acupuncture. And ears is very good for things like PTSD, for people that wanted to quit smoking or quit drinking. So those are things that are very effective using ear acupuncture, because the points are so close to the brain and it helps with all the nervous systems. And that's one type. The other types are Japanese acupuncture. There's also Korean acupuncture. We also talk about balance method. So there's a lot of different types of acupuncture that people utilize. Okay. So it's based on smart people, these are the effects of acupuncture. The first one is neurotransmitter theory, which is where the brain releases basic neurotransmitter, okay, such as endorphins, other types of hormones that affect immune systems. So like it said on the slide, it affects the higher brain areas. It stimulates the release of hormones that helps with immune systems. The other one is autonomic nervous system theory. It stimulates the release of norepinephrine, acetylcholine, and several types of opioids, and it basically helps with pain. And the third type of effect is gate control theory. This one I really don't like, but basically what it's saying is that stimulating with a needle would overcome the pain that you're already having. So it's beating the pain that you already have. I mean, some practitioners might use it. It does work. Not the best way of treating, but it's another theory. Okay, the fourth one is the vascular interstitial theory. It manipulates the electrical systems of the body and basically helps and facilitates healing. The last one that they talk about is the blood chemical theory. And it affects the blood concentration of triglycerides, cholesterol, and phospholipids. And it helps to regulate the body as a whole and to bring back homeostasis. So based on all the acupuncture studies, the National Health Organization and WHO basically said acupuncture is effective in treating all these symptoms, all these issues that are shown on the slide. Ones that are underlined are the ones that I dealt with and I have success with. Um, so there are many, many things that acupuncture could heal, help with, because it is a whole person medicine. It affects the internal side. Uh, we know acupuncture, everybody knows acupuncture for pain, but not only for pain, but it helps with all the internal things. But some of the things may take a little longer than just one treatment or two treatments. Depending on how long you had the issue for, sometimes it's going to take about half that time to work on that issue. Okay? So benefits of acupuncture. So it helps with overall well-being. It's going to reduce stress, balance hormone, and ease anxiety. It helps with people with depression and a lot of things. I mean, a lot of stress that we're currently undergoing with COVID, that is something that acupuncture would also help with. It improves recovery from chemo. It helps with side effects of pain. It would decrease the negative side effects such as nausea, vomiting, also peripheral neuropathy is another one that acupuncture would help with. Provides pain relief, helps with headaches, migraines. It's very good for chronic pain as well, including neck, shoulder, back, all the key areas that we're having issues with. Acupuncture really helps with insomnia and does not have any side effects with acupuncture. But the other one, pregnancy, labor, and postpartum health, these are things that acupuncture could also help. So basically, again, to stress that there are no side effects of acupuncture besides some bruising here and there. It helps with all kinds of pain relief, helps with stress, and also helps with bringing the body back to homeostasis. So in conclusion, for acupuncture with cancer care, these are the ones that I work with. These are the symptoms that people have provided when they came to me. So with cancer care, with acupuncture, it reduces nausea, vomiting, and fatigue. It provides pain relief for neuropathy, any kind of issues that are being caused by or having issues with cancer care. Acupuncture also helps with digestion, assists in stress management, and ongoing any kind of physical, mental or emotional issues. Just to cite an example of digestion, a person came to me with indigestion, major pain. So I did maybe about 4 points on the hands and on the toes. Waited for about 20 minutes to let that take effect. And at the end of the session, the person had some woozy feeling, wanted to go vomit, and basically all the stuff that wasn't digested came out and was relieved of the indigestion immediately. So yes, I had some great experience with that also. Many wonderful sessions with people that are going through cancer, working through cancer. I'm so glad that I could be there to help, not only with acupuncture, but also coaching, helping with Western medicine. And these, so basically acupuncture, it is the safe and most effective way, a natural way to regain and help with health and well-being. And so at the bottom, it says the Department of Health and Human Services states that promising results have emerged showing efficacy of acupuncture in adult post-operative and chemotherapy, nausea and vomiting, and in post-operative dental pain. There are other situations such as addiction, stroke rehab, headache, menstrual cramps, tennis elbow, fibromyalgia, myofascial pain, osteoarthritis, low back pain, carpal tunnel syndrome, asthma. I mean, all these things that basically acupuncture really helps with. So not only acupuncture, I just want to, I just threw this in there because we have to get moving. We got to exercise. We have to stretch. We got to work on balanced diet. Some herbal care. We got to have good sleep and ultimately manage stress. And bottom line is enjoy life with all these things. Um, so when people come to me, I not only help with their issues, their symptoms that they're showing, but I would go furthermore and help with any kind of exercising or provide any kind of coaching that they need for balanced diet and to help with stress. Okay, so these are the things that acupuncture and me being there and having worked with all the cancer patients, I work with all kinds of people of walks of life, and I've been able to help out.